Hello, everybody. I would like to welcome you all in today's interesting session, and we have an amazing personality who has joined us today. I will just give a little brief but lengthy introduction about Dr. Cheema, who is going to participate in today's important discussion. As you all know, this is the time when COVID is dominating whole world. It is very, very important for all of us to understand how we can save our kids, how we can take care of them during COVID-19. So our topic is pediatric care during COVID, and we are having Dr. Cheema. Doctor, first of all, I would like to welcome you on today's informative session.
Thank you very much for inviting me.
So friends, let me just give you a brief introduction about Dr. Cheema, who is a neonatologist pediatrician at St. Michael's Hospital and an assistant professor in Department of Pediatrics. That is not the only thing. Faculty of Medicine as an assistant Faculty of Medicine at University of Toronto. Dr. Cheema completed his medical training in UK as a pediatrician with a special interest in neonatology. In 2001, Dr. Cheema decided to came to this land of opportunities, which we lovingly call as Canada, to work as a pediatric fellow in neonatal transport at the hospital for sick children, and after 2 years became a staff pediatrician there. He's a keen educator, and it is my pleasure to participate with him on today's interesting topic, pediatric care during COVID-19. So, Dr. Cheema, what would you like to share with our viewers today?
So what we will do, thank you very much first of all for inviting me, and good evening everybody. So what I have done is I prepared some slides and I will go through them basically, and at the basic is, as you know, this unprecedented times of COVID-19, and I have never dreamt about that in my life that we go through that, but unfortunately we are living through that period basically. So at the moment, what I'll take the opportunity to describe about what the COVID-19 is, give some information about the virus, because a lot of time people, my patients do come to me and ask me, okay, what the virus, give me antibiotics. So I try to explain a little bit. I take this opportunity to educate a little bit about the virus itself. And then we go through the signs and symptoms of what the disease is all about and how we can prevent it. And it will be general for everybody, but definitely as I'm a pediatrician, I always love to be a pediatrician, so I will move on to how the best we can do it for children and what are things which we can look into children and how we can prevent that. And the last part of the discussion, I will focus on our vulnerable populations and see what we can do, what is happening at the moment, and what are the best sort of solutions we can do for that basically. So I know as since COVID-19 has been described in December of 2019, there has been a lot of information. We are inundated by information on the media and also mostly on the social media. Some with good information, some with misinformation. I won't say lies or anything, but definitely misinformation because it's a new thing.
Absolutely.
It's a new thing, and people are learning about it. Nobody knew about it. And there's a lot of research all over the world. And we are trying to get more and more information how to best to avoid it, prevent it, and how best to treat it. So at the same time, the information is changing so much that because of that research going on, every week you see plenty of papers, and you can see in your own, basically as a general public, you see newspapers publishing almost on a daily basis new research and from that area to that area to that. It is true. I will try to stay with the basic facts which are known now and which are published in good sort of medical journals and information from the Pediatric Association, governments, and other world organizations like WHO. I'm trying to avoid all the conspiracy theories out there,
Right.
and the controversies out there,
Yeah.
and just stay to the basic facts about that. Okay?
Yeah. So friends, As you can see, our intent always is to bring the right source of information. As Dr. Cheema rightly said, there is a lot of misinformation, especially like in today's era where social media is very prominent, and all other sources of information. So many times you don't have an authenticity of the right information, especially in a situation like COVID-19. And this today's discussion, as you all know, is being presented to you courtesy Chris Hope Services, which you all know is a non-profit organization committed to supporting the differently abled population. At Chris Hope, they provide services to individuals with both visible and non-visible disabilities. And I would like to especially mention our wonderful and amazing personality, Cheema Shah. She is doing an amazing job for the community. And bringing such kind of personalities in front of you and talking about these kind of topics definitely is going to bring a lot of right information. And I think Dr. Cheema, thank you very much for joining us today. This is what our intent always is, to bring the right source of information for our viewers so that they can get benefited out of it.
Absolutely. Hopefully, I try to do my best basically. And I just want to add on about what you said about Cheema, and she's absolutely amazing person. She's doing a wonderful job. And honestly, that's why I got involved when she said I never said no, and I said okay, fine, now we'll do it, because I know she's doing something very good for all of us. So let's just start if I may.
Absolutely.
Okay. So coronavirus, as we call it, is not a one virus. It's basically a group of viruses which causes diseases in animals and in birds. We knew first about coronavirus in late 1920s, and then in 1931 it was first described as a disease in chicken in a poultry farm in North Dakota, and where they found that it was a deadly disease and it causes death of almost 90% of the poultry flock. But in humans it was first described around 1960. And then in around 1968, and in 1960 basically it was found both in UK and in USA. They found out that there's the physicians at that time, they realized that there's a different sort of common cold, not different than that normal common cold which is happening. And it took another 7 or 8 years before they can group together some of the known virologists at that time, and they gave the name the coronavirus, this separate sort of entity which is called the respiratory virus. And it was published in the Lancet journal, which is very reputable medical journal. And since then, we know that there are a number of these coronaviruses. Most of this causes common sort of a cold. But then, since 2003, we found out that it is not a very simple virus. There are certain strains of it which can be very deadly. And if you remember, SARS in 2003 was the first different lethal type of coronavirus was discovered. It started in China and then came to Vancouver and then to Toronto as well. And after that, there was another called MRSA, which is Middle Eastern Respiratory Syndrome, which is also called camel flu, which was started in Jeddah, Saudi Arabia. And then in 2019, we had this coronavirus, which is called COVID-19, because it was discovered in December 2019, when it was finally discovered that this is a type of coronavirus. So that's why it's called coronavirus disease of 2019. So it is COVID-19.
Oh,
okay. So now this is a picture which you are seeing is that there is you can see bats and certain animals and then a human. So that just depicts that how these viruses can transfer from animals to the human basically. And let me just go back and just describe a little bit about viruses, because as I mentioned before as well, a lot of time my parents come to me and ask, okay, doctor, is viral? I tell them, look, this child has viral infection. They say, okay, we give some antibiotics. And I try to explain to them that viruses are different. They're not affected by antibiotics. So virus basically is a microorganism, and it stays, its host is basically humans or animals or plants even. And there it replicates itself. Okay? And then it causes the problem basically. So what is happened was that viruses, we didn't know about viruses, we knew about bacterial infection, but then in late 1890s, certain scientists at that point realized that there's some sort of a different organism other than bacteria, which is causing infection, but they could not see in the normal microscope. Those are 1890, there was ordinary microscope, they couldn't see that. And they said there was something else. Then in late 1890s, 1898, 1999, there was a Dutch scientist and who found out that, look, there is a different organism which is much smaller than the bacteria, which is causing the problem, and they call it a virion, and there hence the name came at virus basically. So what these viruses, they're very small viruses basically. And what these viruses does is that they invade your body, they hijack your cells, and they start replicating. They have their DNA material basically, which is the blueprint of formation basically. And they replicate. And when they replicate, they use your natural resources, which would be used by normal body. So I'm trying to be very simple now, avoiding all the medical jargons and everything. So I hope you appreciate that. So, and then this, when they use the natural resources, it can affect the body, and then it triggers your immune response. Our immune system, God has given a very nice defense mechanism in ourselves.
Yeah.
And when the immune system realizes there's something alien coming in, it starts producing soldiers or fighting cells against that particular organism. And then it starts fighting. And when the fight goes on, there can be damage. This causes a lot of inflammation. Okay, and that inflammation leads to a lot of fever, and that makes you sick. That's how virus makes you sick, basically. And when it is overwhelming your body, you become more sick, and God forbid, it causes, as we know in coronavirus and other viruses, it leads to death as well in some cases, unfortunately. So when the immune system is already exposed to a virus, it knows, it has a memory. It knows if the next time it's exposed to that virus, it starts producing that particular cells, fighting cells or soldiers, and they do not let these viruses to replicate and cause problems in the body. One way is that you are exposed to the virus, and the other way is that you give vaccination, which we give vaccination to children. And these vaccinations give very small amount of virus, dead or live virus, and that just jogs the memory of the immune system that look, this is the virus, and this is the sort of antibody you need to produce against that. So then in a later life, when you have that, as you're exposed to a heavy load of that virus, immune system knows. Okay, that's the virus. And memory starts building up, antibodies and factories start working, and they produce all the cells, and they start not killing them, but decrease their replication. So when they don't reply, they die off. But if they don't, in the case of COVID-19 and viruses like that, we have hepatitis B virus, and we have the hepatitis C virus, and the famous hepatitis, the HIV virus. And these two viruses which we know, and then the body doesn't know. The immune system does not know what to do, and it produces a lot of cells, which instead of doing some good, produces some harm and causes a lot of inflammation, and then it leads to a lot of organ damage in the body and leads to death. So that is the basic sort of background of how the virus and what it does basically. Okay. So now we move on to the next slide. I want to show about the other viruses basically, which is as this slide shows you about the three lethal viruses of corona, three different types of coronaviruses. First one is MRSA. It is first because, although it was discovered in the middle, but it was first because it is very lethal. And it was, you see, 2012 was the first time it was seen in Jeddah in Saudi Arabia. Then 2015 there's another sort of outbreak in South Korea, and then 2018 there was another one in Saudi Arabia again. And the death rate of this virus is almost 37%, which is quite high basically. But thankfully it didn't spread too much. It was contained to local because spread was a little bit more difficult, not as easy as the COVID-19 one. The SARS was the first of the lethal coronavirus we knew. And I remember in 2003, I was a fellow in hospital for 6 children and 20 before at that point. And suddenly we realized there's some sort of a disease going on in China, and then it happened in February, March. Again, the same sort of time frame. It happened that we had the first few cases in Vancouver, and few of the medical personnel died as well, who were the first responders to this virus and nobody knew about that. Basically, we didn't have much information, and they contacted the virus and unfortunately died. And then within a week, we had a few cases in Toronto, and a couple of medical personnel died over here as well in Toronto area. One of the teaching hospitals, we don't know the name. But, and it was a very scary time at that point. We were told to stay in one hospital, don't move out and this and that, but luckily it didn't spread too much basically. But again, the death rate of that SARS virus, which is called severe acute respiratory distress syndrome, is SARS, and it caused a death rate of approximately 10%. Mm-hmm. And then, as you know now, it's happened, the COVID-19 thing, which happened in December. But I tell you, I mean, again, this was first isolated in Wuhan, city of China. And I tell you a very interesting thing, basically. It's a personal first-hand information.
Right.
I have a good friend of mine who works for a multinational company who has a factory in Wuhan.
Mm-hmm.
And he was telling me in February of this year that he goes to visit this factory every March and every October. And in September, when he was planning to go there too, but his general manager of the factory called him that, don't come, there's some sort of respiratory flu-like illness spreading, and it is causing a lot of death. Mm-hmm. At that point, basically. And it took us a few months for the authorities and medical personnel and scientists to figure out that this is a new novel virus, which is causing a problem, causing a lot of death. And then December 2019, as history goes, it was declared that this is COVID-19, and then early part of this year, it was declared a pandemic by the WHO. There's a lot of controversy now that you know more than that basically. But see, then you see at the last section of this thing, you will see, I will omit all the other things, but you see last section is the mortality, the case fatality rate.
Yeah.
So the case fatality rate or mortality or the death rate of coronavirus is a shooting target, basically. We don't know what exactly it is. The initial figures which we got from Chinese research and Chinese data basically was almost 7%. But then there was a time when the people were more sick, we knew, and there were most of the people who were coming to the hospital and the death rate was high. And this 2.9% is from the Johns Hopkins University. And Johns Hopkins has done a wonderful thing. They have created a dashboard of COVID-19, and it is updated every day. Mm-hmm. It gives every day the figure, the numbers, how many people affected, what's the death rate, and it then shows, you should go on the internet and you can find out basically very easily. And it shows about all the countries in the world what the number is. At the moment, today basically, when I was coming out, I saw that it is around 39 million people affected worldwide.
Wow.
And almost more than 1 million people have died. Mm-hmm. And unfortunately in Canada, in America, there are like more than 200 deaths and little less than 8 million people affected. And in India, we see that again it's number 2, little less than 8 million people affected there as well. The death is definitely thankfully
very low,
than there. In Canada, again, it is in less than 100,000, basically. I don't know the exact figure with this. The other interesting figure from CDC, the Center of Disease Control from America, has published a data 0.68% as a death rate, which is less than 1%, which is very low. Yeah. And probably right as well. But this is again a very sort of controversial thing because there are a lot of people who we don't know who are affected, who are not tested and everything. So, but at the moment, the scientific world has taken the Johns Hopkins data as the better sort of figure of 295, and we're sticking with that. Right. There's another very interesting sort of death rate I want to mention, which I was surprised to see as well, and that is published by WHO in the middle of this year, and then again it was redone in regulated, and that was the deaths per million of population.
Yes.
So it is. It's sad, but interesting for us, a medical sort of thing, basically I'm mentioning. And the death rate per million in America is around like 750. Right. In Canada, it's 250. And the highest death rate per million population is in Peru, which is 1031. Mm-hmm. And we don't know what it is. Basically, people are still researching on that. Yeah. But the most interesting thing was when I saw the death rate in Pakistan and India, mm-hmm. which is not the lowest, but in the lower region. And it was surprising. It was 39 1 deaths per million in Pakistan and 60 or 70 deaths per million in India, which is very low considering our population and our medical system and everything,
Right.
which was good as well. I was happy basically because we don't have that sort of resources and somehow or the other it is low.
Maybe, Dr. Cheema, I think the immunity level is a little bit better as compared to these North American countries or the European countries.
It should probably be right. Again, there's a lot of things in that, but another question, I'll give you one sort of quick answer to that. There was a study out very recently published from Karachi. In the last month, basically, it was published, and it was very interesting to hear that they noted that in the lower poor areas of Karachi, the antibodies, which is the fighting cells, and which shows that there's some sort of immunity. But I don't want to call that basically, but definitely the antibody rate or the immune rate was like almost 50% people had that sort of antibody level. They were exposed to this virus before, or other types of coronavirus, we don't know.
Yeah.
In the affluent areas, it was around 30%. And very surprisingly, in the doctor community, in the medical profession, nurse and doctor both, and they say that it was around 12% were immune to the virus. And which is very interesting. And they were their theory was that probably the way it is looking at that, they say probably in a year's time, or even more than that, maybe 70% of the 2/3 of the population may get immune to the virus. We don't know.
Yeah.
I'll leave it like that.
Dr. Cheema, I know. First of all, I'm really impressed. Like, and it's a good piece of information for me personally, because I didn't know like this coronavirus is such an old thing. Yes, I was just thinking this is something new which has happened to the world.
I'll tell you one more thing in that was the thing. When I was reading through the literature, it was very surprising for me as well that they have some of the literature mentioned that the ancestors of coronavirus was known to us, to the humans, since 8000 BC.
Wow.
I don't
So it's an old friend.
Oh, it's old friend. But yes, but
Now it's showing more love and affection to us, right?
yes.
And Dr. Cheema, like one more thing. I don't know how authenticated that information or how relevant I'm talking, but I know it's in my favorite Mambi. I read it somewhere, and it was, I think, a report from WHO. But I'm just sharing my little knowledge, and I might be wrong onto that. That South Asian community, especially, we have some similar kind of protein in our body, which is as similar as to this coronavirus. So because of that similarity of the protein, I think we have that immune system which has already been developed.
Yes, as I said, I mean, if you know the basics, that's why I explained a little bit about the virus and the immune system. Because if you understand the basics of immune system only works if you have some sort of a knowledge.
So it's a natural intelligence.
So there must be something basically they are exposed to. That I mentioned this study about Karachi in the lower slums. Maybe they are exposed to a lot of other strains of coronavirus. Maybe that is giving them some immunity. But choose out for that, we don't.
Right.
Okay. So now we move on to the next slide. This is a interesting sort of picture which you see on the newspaper a lot of time. I just put it just to explain a few things basically about the virus in general. And you see this is like a spike. So, and corona is basically a Latin word as well that makes a crown or whatever. It's because of shape they have given this sort of name. And you see that there's like this outer layer of protein. And the most important thing I want you to focus is that without involving any more scientific sort of thing, is you see a red sort of rim around that. That is the cell wall of the virus. Virus has a unique ability, a structure rather, that they have a very strong cell wall, which is made of protein, and in some cases, like in COVID-19, it is sheeted. On top of that is a lipid layer. That's why viruses are a little bit difficult to kill. And that's the difference between bacteria. Bacteria can be killed by antibiotics. If you have a pneumonia or strep throat, you give a course of 2 days, 2 weeks of antibiotics, or 1 week of antibiotics, kill whatever and go on. But viruses, that's why it's difficult to kill, and that's why it's very difficult to make strong antiviral agents against that. That's why I wanted to put that picture here to give you an idea about that. It's like a fort for them.
I see.
Okay, so the vaccination gives the immune system a response for these sort of things, so they don't let them replicate, multiply, and die back. And that's why we know that HIV virus is still, we have antiviral, we can curtail that, but cannot cure that.
Right.
Okay, hepatitis B virus is there for ages. We have a produce a vaccine, but we're not able to produce an antiviral to kill that. The new antiviruses are there. And that's why there's a problem with these viruses. But nature has given us such a strong immune system, and it's such a system that most of the viruses, which we know, our immune system take care of that. And that's why when the parents come, and if you have gone to the doctor a number of times, they're okay, there's a virus, and it will 3 to 5 days.
Yes.
And that's what it happened.
Yeah.
The 3 to 5 days, our immune system presents enough of the fighting cell that they curtail it down and we get better, get on with the life basically.
So the medicine that we give for the viral is basically just to give you a kind of consolation or just a support system.
Yes, that's something. See, that's what as an educator, I'm always teaching the students and our residents not to use antibiotics, because that's the antibiotics for no reason.
Right.
And I mean, some of my patients, if they're listening, they know that I'm very miser on using antibiotics, because we know, and it takes time to explain to the people, look, this is why, there's a different treatment. It's not killed by that, it is killed by its own system, kill it.
Yes.
Just take some Tylenol and will it get better.
Yeah.
So now we come up to how these viruses are transmitted. And that's important. So most of the viruses, there are three major sort of transmission routes, which is contact transmission. Contact transmission is like when you are direct contact with the infectious agent, like I'm shaking your hand, God forbid if you're infected, I can pass on, you can pass on to me, I put the hand on the face and everything and it transmits to my mouth and go into it. There's some people routes as well basically, but then there's another thing is you touch the surface. If somebody has an infection, touch the surface, I touch them there and take it. That's called fomite transmission basically.
Yes.
Okay.
Yeah.
So, and then the second transmission route is like droplet infection. In droplet, I'm talking,
Yes.
I'm continuously throwing up droplets.
Yeah.
Okay. And those droplets, if God forbid I'm infected, I will pass on to you if you're very close to me.
Right.
It's 6 meters. So that's where it came.
6 meters or 6 feet?
Sorry, 6 feet,
Okay.
2 meters.
2 meters.
So that's where it came up, that the social distancing, what
Yeah,
you
right.
say, 6 feet or 2 meters essential basically. And when it is more than that, that is called airborne transmission. Airborne is when there are very smaller particles,
Right.
and they are spread. And if, say, for example, there's certain type, we know for sure at the moment that COVID-19 is mostly transmitted through contact and droplet transmission. Airborne, people are still not 100% sure that because of that. WHO at one point did mention that it can be airborne as well, but it was not taken up by the scientific community. So at the moment it's contact and droplet. Airborne happens in certain sort of situation, like say for example, if somebody is infected, he's singing or he's screaming loudly, or somebody is in the exercise gym basically and they are puffing and pumping air and everything, so they are breathing a lot, so they are a high load of the droplets are coming out, and then we can infect other people basically. So that's where government stop all these sort of things. And if you are indoor, then if somebody is infected and you say closed environment, then probably the droplets can stay there and travel for a distance more than 6 feet basically, and somebody God forbid can get infection basically. That's what the restriction is more. Now it will make sense for people why indoor is less and outdoor is more basically, because outdoor is just continuously air is taken away basically, and that's very important. If you're in a closed system, like we are when we are in the ORs with the pregnant mothers and we are intubating, then we have to cover ourselves properly. So that's kind of where it can be aerosolized basically the environment, and people can get it basically. Okay, so that's a closed environment where there's not proper ventilation, everything. Especially in our part of the world, we are from India, from Pakistan, in our part of the world, with the closed air conditioning system, one of the culprits. That's why the summer months there was not. So that is one of the theory basically, that in closed environment, in closed room, and there's it does not have a central air conditioning system, 90% of the house basically, and so that circulates the droplets all around and it can be spread to different parts. And if you were coming in after me, God forbid, the particles still circulating in different parts of the room and you can get it basically. So the contact basically, so at the moment for corona, for all practical purposes, mostly contact and droplet.
Mm-hmm. Yeah. That is such a wonderful piece of information, I think, and all of our viewers will be very highly impressed with that. And Dr. let me tell you something interesting, which I like about this part of discussion. You are making it so simple for any common man, for any a normal person like me who has no background of medical terminology, and it's very very easy for me to understand. And when you know something, right? Even rocket science, if you know, it is not any secret.
Yes.
So that all depends upon how the things has been explained, and I think this kind of information can always help all our viewers to understand a little bit more about coronavirus and to understand the logic behind the 2 feet.
Yeah.
I thought they kept that logic to keep the husband and wife separate. So in house, you maintain that distance, right? And there was another funny story actually, which I actually shared a couple of times. In one of the African countries, they came to know that there is not even a single patient of COVID-19. So they were very impressed. So all the journalists and all the media from all across the world, they went there into that country to understand how they controlled coronavirus. How come there is not even a single case which has been reported over there? So they went and they started interviewing the Prime Minister and asked them, and the Health Minister, that what exactly you guys did? Such an amazing response that there is not even a single case of coronavirus. They said, yeah, we don't have testing machines here. So they really don't do any testing. So problem solved. Problem is solved. But guys, that was just on the lighter side. Don't try to do that. You have to make sure, if you, by any chance, you feel that you have any problem, it is best to get in touch with healthcare professionals because they are the best guide in today's scenario. Especially, Dr. Cheema, it's very interesting that people are calling 2020 as an year of survival. So either it is your life, or it is your business, or it is your financing, or it is your economy. Everything is on the survival mode,
Yes.
right? So it is very, very important to survive in 2020. We will grow, we will do some progress in next year, but let's survive first.
Absolutely. Prevention is always the key.
Absolutely, yes.
So next we move out to what are the signs and symptoms of that. I'll give you a general sort of it's a general slide which you can see. There's a lot of symptoms basically, fever, cough, fatigue, body aches, and if you look at that basically, they are more or less with all sort of flu-like illnesses will have the same sort of symptom. But why I highlighted 3, fever, cough, and shortness of breath on top of that, and they are the 3 cardinal features of COVID-19 basically. They will almost have fever. Cough is almost always there in majority of the situation basically, and when there's shortness of breath, then we definitely are moving into next stage of the disease basically. And these symptoms which happens in children as well, more or less, most of it. The one other thing basically in this scenario of COVID-19 is the loss of sense of smell. When these symptoms with loss of sense of smell is concerned, then clinically you have a high degree of suspicion of COVID-19. And we know that the incubation period of this is around 2 to 40 days. And that's where comes the
14 days
quarantine period basically. So once you're exposed to the virus, it may take at least 48 hours for the virus to show itself, maybe different symptoms, up to maximum 40 days basically. So many of these complications of COVID-19 is because of, as I mentioned before, the immune system is not used to this virus, and so it triggers a response which can, in medical terminology, I'll use a few medical terms there, we can respond in response to that. It can trigger a reaction and produces a lot of inflammatory cells. Okay, in medical terminology they're called cytokines, and it's called cytokine blast basically, or storm basically. And when it happens, it can damage the organs in different parts of the body, Like lungs are the most common one. They have almost always they get a little bit of pneumonia and then heart problems, liver problems, and coagulation disorders, and God forbid you do that. And then it can also cause some clots, which can be in the legs or in the chest. And if you're in the chest, you probably have breathing issue. And when it gets to the brain, it can cause stroke-like situation. There was a case report in early when it was spreading in America, in New York, that there was a case where a young person was brought in the hospital with a stroke. It was very young. And when the physicians saw that and they investigated, it turned out that he had COVID-19. Mm-hmm. And then they realized that, look, what can it do? Basically, it can happen in different scenarios can happen.
Right.
And these are, fortunately, these are when they got very sick. It doesn't happen to everybody, basically. Okay, so in further slides, I will explain a little bit more about that, basically. So,
Dr. Cheema, before we go further, I would actually just something came into my mind regarding the mortality rate. The mortality rate, especially in case of COVID-19, is only like little less than 3%, if I'm not wrong.
Yes.
Whereas as compared to SARS and the other diseases which we have seen in the past, which was 10%, and even I have seen a figure of like more than 37 or 38%. So what does that mean? It is not as deadly as those diseases were, or we are a little bit more developed in terms of our scientific research?
See, it is important. I don't want to, first of all, don't take me wrong, I don't want to downplay the COVID-19. We have to keep our guard very high.
Absolutely.
Definitely. But answer to your question basically is yes, it is not as deadly as the other two coronaviruses.
Right.
One has much higher 37% death rate, other one 10%. And as I mentioned before in the slide, that the CDC had mentioned that brought like 0.68%, which is less than 1%. So if you get like a million people, only 1% or God forbid those people will die. So it's a number wise, it's a very small number.
Right.
But there is important thing which we need to understand, that because this virus is spreading so quickly,
yes,
and it can make people very sick,
yes,
and it produces it causes a lot of not only that discomfort among the families and socially and economically, but it also puts a lot of strain on the government resources, because these children, especially and adults, they got so sick they have to go to the hospital. Hospital beds are occupied. In the first round of COVID-19, I must say, in the March, April, all the hospital surgeries were delayed, were cancelled.
Yes.
And that puts a lot of strain on the medical system itself, and it puts a lot of people who needed the surgery. And we are knowing the facts now that a lot of people with surgery, cancer patient needed surgery were delayed, and they have more cancer has spread, or the heart problem were delayed and leading to death and everything. So it has consequences because it involves so many people,
So much, yes.
in a short period of time, and use so much sorts of medical and otherwise that it puts a strain. So that's why it is important that not to put our guard. Although the death rate, if we believe those figures, which probably are right as well, is low.
Yes.
That makes sense?
Absolutely, and I think there's another point which I would like to highlight. Especially, I have seen the government all across the world, they have become very conscious onto it. So there was restrictions were put up there, and then they stopped traveling, which I think helped a lot in spreading the disease.
I mean, yes, it's good and bad, and I don't want to go into too much of the controversy. I have my own personal views about that as well. But definitely, as I said, I mean, it's the use of so many people getting infected so quickly, putting a lot of strain on the medical system, that everything put a strain on that. All the death rate. I tell you my personal, just on Tuesday, I had one of my family patient, children are my patient, and the families and the parents are the family basically. And one of the family came, and they said they had COVID-19. We said go, and I had a telephone discussion with them. They were positive and everything. And she came now, and they were negative and everything. So they brought the child, and she said, "COVID-19, what that?" I said, okay. He said, oh, it was like even less than a normal flu.
Right.
So these are experiences.
Experiences, yes.
And to that effect, I will tell you one more thing. In America, they have published that the COVID, exact number of COVID-19 cases are 10 times more than what they are
here reported. Absolutely. I personally do agree with you on that.
And on that, I tell you a definite sort of a study which was done by John Hopkins end of April, which showed, and they took like antibodies. And antibodies are when already you're infected with COVID-19 or with COVID-19, they have antibodies against COVID-19. So they tested this people at random standing in lines for grocery stores and other people, and they were healthy, otherwise no problem or whatever. And they found out that at the end of April, I think, and they found out that 20% of the population had positive antibodies.
Oh, so it means there might be chances.
So
they were infected and they already had the antibodies.
Absolutely, they never knew that, or common cold or whatever. And what you can take out from that is that if you just assume that to make the calculation very simple, New York maybe has a population of 10 million. So 20% mean that almost like 2 million was infected.
Yeah.
And that's the time when the number of New York was like 320, 30, 40, something like that for the COVID-19 positive people basically. So it means that rest is like 18% more over there which are infected basically.
That's right.
And then the death rate becomes more skewed basically.
Absolutely.
So let's move on. So this is next slide shows you the fever. This is the published research from China which shows which are the symptoms are more common, and you can see that fever was the cardinal feature in almost all these sorts of cases basically, and followed by fatigue, dry cough, and all those sorts of things basically. And now we move on more to the next slide, which is more related to children. And there were 11 different studies published in different journals in mid-April 2020. And one of the things which is true as well, that thankfully, children are not that badly affected as the adults. But still they can pass on the disease to the adults who are more vulnerable, to older people, unfortunately. And coming back to mortality, basically, unfortunately, most of the mortality was among people who are more older people, basically. Okay. I'll come to the next slide and come to mention this. So, but these studies point out that, as I said, number of children were asymptomatic, but still they are, as I said, they can pass on the infection to other people. And 92% of children were symptomatic, and the crux of all the 11 studies that we take out. And they get experience from not only from China, but also from Europe and also from America as well. But in majority of these studies, you can see that the majority of children will have some sort of fever, cough almost always is there, sore throat, and good, like 30% of children will have some sort of sore throat, and gas, runny nose, diarrhea, etc. And the last part I will explain to you at the end, basically. But the other thing which came out from these studies, that the younger the children, more seriously they will be affected. So there we have to be more careful for our population. That all the studies mentioned the children who are less than 1 year of age, they are more serious effects of coronavirus than older children.
Right.
And in those studies, we found out that the children who were admitted in hospital, 62% were less than 1 year old.
Oh.
So almost you can claim that 2/3 were under 1 year of age. And out of those, 5% were admitted to ICUs, and 3% of the children died as well.
Oh, I see. So I think it is more of related to where there's a chances of low immune system.
Yes.
So especially like very young kids and the old age people.
Yeah, absolutely.
Right. But recently, Dr. Cheema, I have seen that there's a lot of young people in the age of 30, 40, they have been infected.
Yeah, now they're getting infected basically. Infection is not an issue basically. They will get infected. If you expose yourself to the virus, you will get infected.
Yeah.
But how do you react to that basically? And that is quite an interesting point now you will mention now, because otherwise you'll forget basically. And that nowadays in the second wave,
right,
we definitely know that the people are not that sick. If you just imagine, there was one nice graph which I didn't put it basically, which showed the numbers, our numbers now in Ontario. is more than our numbers in the peak when the first wave.
That's right.
And the first wave, we were inundated by the patients in the hospital.
Right.
Remember that?
Yeah.
Now there are not many patients coming to the hospital.
Yes.
And this is being described in Italy as well, where there was the most scary thing for us was when the pictures coming out from Italy.
Yeah, the patients are outside the hospital.
And it was even from America, they were very scared.
Right.
Okay, in England as well, there are a lot of doctors, physicians, nurses who died in England as well in the first wave. Okay, and a lot of them were Asian communities. A lot of people are from our backgrounds are over there as well. And but now they're saying that in Italy they reported that out of 1,000 beds for COVID-19, only 130 were for respiratory. We know for sure, scientific people know for sure that definitely there's something different.
Right.
Why? They don't know. And this is one of the reasons, probably. As I said, I mean, the facts keep on changing because the new research coming out, because there's so much research started in February, March, April, which is now becoming mature and coming out basically, that we don't know. Because now a lot of people, like say, people who are going to university and everything, they came on the road, they're going on mixing up.
Yeah, partying and all that.
Partying, kissing, everything.
Social gathering, yes.
From the transfer and everything. And probably the immune system is good enough.
Yes.
And their body system fights it well. Maybe that's why they're not getting that sick. And other reason for that is definitely people, anyone a physician as well, we know more about the disease now, a little bit more information, we don't know anything more basically, but definitely we know more than when it started. Even in China when they started, they don't know what to do basically, how to treat them. That was the reason why they were higher test rate initially, but now we know more pathologically as well. So coming back to our sort of slide as well. So this is for children. This is published from the Pediatric Society of Canada, basically. So they have distributed children into 3 groups basically. Depending on the severity. The mild disease, you will see there will be children with either asymptomatic, or there will be very minor sort of symptom like runny nose, or maybe minor bit of cough or sore throat, not cough, but sore throat, and low-grade fever. And WHO described that if it's less than 7 days, it's a mild sort of disease. But there will be no other changes, like they don't require oxygen. So they mean if there's no color change on the lips, they're not going blue or anything, they don't need oxygen. And if you do the chest X-ray, there will be no sign of pneumonia. So that's a mild disease. Right. In case of moderate disease, you will see there will be fever. Definitely, and apart plus all the upper respiratory tract infection symptoms like runny nose, sore throats, and then they will have headache. But then if it adds to loss of smell and taste, it's definitely pushing into the moderate sort of a disease. When the children understand you, they cannot smell it, mommy, whatever. You should be aware that there's something not right and should be tested for COVID-19. And then there will be, if you do the chest X-ray, it will show some signs of pneumonia, but still there's no overwhelming sepsis or overwhelming infection to bring the child down. And you can see there's some breathlessness, there will be some increased work of breathing in the children, but still there's no signs of cyanosis or blueness or the rest, which will tell us that the child can, if you go to the hospital, you need that the oxygen levels are low. Right. And in the severe disease, definitely the future respiratory stress. In the simple term, for the mothers who were looking at that, basically we see if the child, I will just simplify it, if the child is less than 1 year old, their symptomatology, their respiratory rate is more than 60, definitely is significant. And if older children, it's less than, if the respiratory, the breathing rate, number of breaths per minute is more than 40, you know definitely the child has significant respiratory distress moment and should be checked. And apart from that, then you will see some neurological signs. The children may be different levels of consciousness in them. They might be comatose, they may have seizures as well, with the fever and all the other symptoms. So that probably is definitely shows you that this is the third laboratory. You should be consulting the physician or ER, wherever. And then there will be other like dehydration, the vomiting and diarrhea, and child will get dehydrated, they will not be drinking. That is the third group basically, with severe disease. And then there is a critical illness. in critical illness, we see that when the child is very sick. But I think for the mothers who are listening and everything, if you see the child who is having some sort of conscious level changes, they're more lethargic and they're not that awake, basically not drinking, they're vomiting and they're having diarrhea with all the fever and everything, you should not be, definitely you should be getting advice. A third stage is more for the hospital. They should be in the hospital, and that the disease is rapidly progressing, and then will be respiratory failure, different sort of mechanical ventilation, which I don't want to go through because we don't need that, and children will be very, very sick, as I mentioned before. Almost like 62% children are under one year of age needed admission, and 5% of them, 5 out of 100 needed to go to the ICU for that. Then if you go to the last slide, I want to mention something. We'll just go to the slide before that, and before that. Yes, so in the last I mentioned multi-system inflammatory syndrome children. I just want to mention that without involving any sort of major medical jargon, basically, that is for the parents and to understand that. There is another condition which is showed up in middle of April. There were case reports that children have some unusual site of inflammatory response and due to COVID-19, and that was named as multi-system inflammatory syndrome in children, MISC as we call it in our medical terminology. So what you should look for, if any child following the COVID-19 infection has a fever which is lasting for more than 3 days, and he has other sort of symptomatology as well. There's a disease called Kawasaki disease. Just briefly mention that is a disease which is known for many decades, basically, which is, we don't know the exact cause of that, but this is certain after some viral infection, they have some inflammatory response in the arteries, the inflammation in the arteries, and it causes heart problems and all these sort of things. And it is similar to that sort of disease. So if any child who has a high fever for more than 3 days, he needs to be checked up. Okay, and then there is of course, as a physician, I will do certain blood tests which will guide us that this probably is that sort of disease, basically, which needs to be treated more aggressive. So I just want to make a point that if you see the child who is having fever for more than 3 to 5 days, very high fever, definitely he needs to be checked in, and he needs to go to the ER for, of course, COVID-19, but all the other blood tests as well. Okay. Now we move on further.
So I think when it comes to kids, especially like something like this happens in the family, I think it's a lot of pressure on the parents, on the siblings, and pretty much on the whole household. And I have gone through one of the situation with one of the family. They live in Kitchener, and not related to COVID-19, but I could see the kind of stress level. He was a very young little boy, like 1 or 2 year old, and he had some kind of cancer problem in the eye. So they have actually taken out one of his eye, and it was a prostatic cancer. And that was, and the mother has to stop going on to the job, and the father was taking care of the kid and all this stuff. So it puts a lot of strain and pressure on the family.
There's no doubt. There's no you cannot down to that. I will talk to you that at the end of the last part of my discussion, what sort of fact, but definitely children, of course, as a parent, basically that is the most important thing for you, basically, child, and if that is have illness, the whole family.
Of course.
That's it. So next thing is a very important question, basically, which is doctor, is a flu or is COVID-19? So that's another sort of good question, basically, which we are facing every day. But I think I put that slide, is very difficult. It's the one thing I will mention here is that when there's a low prevalence, it is okay. But when we are in high prevalence time, like we are now with the case of 750 or above in Toronto, we have to consider COVID-19 as the number one thing. Okay, So because we have less time, I'll just quickly move on to the next slide, which is risk factor. We know, I won't go through too much detail. We know that older age, chronic diseases, children who are obese and who have other conditions like asthma or sickle cell, cystic fibrosis in the childhood, then chronic disease, and all these things, because the lungs are already compromised, the immune system already compromised, and if COVID-19 hits, it makes it more compromising. So next most important is prevention. We want to focus on that in a small bit time. Very important. As we know, we don't have any major sort of treatment for that. Prevention is the most important thing. And we mentioned briefly social distancing. Number one, face mask, any sort of face mask, clothes basically. You don't need any fancy N95 mask. That is what we use in the hospital and in the OR. Otherwise, we use the normal surgical mask. That's good effect. Hand washing. The most important thing is hand washing.
Yeah.
And as I mentioned, and this is normal soap. You don't have to do like fancy antibacterial soap, but simple soap. And that's why I explained to you the picture that it's a lipid membrane with the soap and sanitizer, which are 6.0 who can do that. And that led to a lot of big names, big leaders of the world using different sort of thing basically. Now after that, people started drinking vodka and everything. It does not come out. It's just simple hand washing. And simple hand washing, I always promote even before as well.
Yes.
Simple hand washing, almost even influenza and good times as well, it decreases the risk of 50%.
Yeah.
Clean and disinfect surfaces, very important. Okay, keep on cleaning that. There are certain strategies mentioned that in the cardboards or the letters, it can stay on for 2 to 4 hours basically on stainless steel sort of thing. It can plastic, the virus can stay on for more than 2 to 3 days basically. So always good when you bring out groceries to clean all those sorts of things basically, wash your groceries properly and then store them basically, very important. Crowded spaces we mentioned before as well that it's very important. Avoid crowded spaces until there's good ventilation, cross ventilation on that. And if you were sick, God forbid, isolate yourself.
Yeah.
The problem basically is, which I'm going to next, very important thing is the diagnosis. The diagnostic test, as we know, it is, everybody knows there's a problem basically. Government was not properly geared to do that until the second wave has hit us. Basically now there's long line, 5 hours, 6 hours. And the test we do is the swab test from the nose, which gives us a result in 4 or 5 days. And in that period of time, you can be shedding infection to other people. And that test has its own plus and a negative basically. In almost 30% of the time, it can be falsely negative. So that means that people who have the virus, they can go out and they can spread the infection to others without knowing. But the most important thing in this slide is the saliva test, which is an evolution. In America, they've already used an emergency order authorization to use that, in which you do your own saliva and give it to the lab or the collection center, and they do it. And that thing, if that comes up, which probably is the most efficient way of screening people, because children go to school and everything, that's a very important thing. Okay, and that test, we need that screen test. Canada has now been approving that, and hopefully we will get that done, and that is the most important thing. And next slide, basically, we'll quickly go through the slide because it's a treatment. No definite treatment. Don't go for drinking different sort of bleaches and everything. There are a number of deaths. All those sort of things, chloroquine, things which do not have scientific backing, please do not do that. The only thing is hand washing. If you're sick, use simple, normal routine, rest, hydration, time on nectar. That's it. If you're more sick than that, see your doctor. Don't try to treat yourself on that, basically. I will go a lot of those things, basically. I just give you the next slide with that. There's a new remdesivir antiviral agent, basically, which is now approved in Canada for 12 years over. President Trump got it when he was sick with a couple of weeks back. And there's a lot of other things, a lot of other viruses which we don't want to use that. If I go to the last slide, basically, I will omit all the other things, basically. I want to talk about the vulnerable population in our group, basically, children, basically. And they are children who have heart and lung disease, and especially, I will basically focus on children with asthma, which is very common, especially in our children. So any child who has asthma and has some sort of cough, and the recommendation from the Pediatric Society is that you use your puffers. Nebulizers is not good because it will shed a lot of droplets around it basically, and inhalers are as good as anything. So use inhaler. Use inhalers quickly, see your doctor, call your doctor. If like my patient, no, I can, all these sorts of things I can do on the phone as well. And so we can use the inhalers very quickly. And if you children are moderately sick, the recommendation is we go to dexamethasone, which I didn't discuss because we didn't have time. But dexamethasone will come up as a medication which is shown that it can decrease the death rate a lot basically. And coming to your point about in our part of the world, they are using a lot in India and Pakistan. They're using cocktail antibiotics and dexamethasone, which has been very effective basically. Plus minus the antithrombotic sort of medication which cause the clots and everything, and that probably may be effective as well. Next slide, I'll take a few more minutes for you if you bear with me, is the supporting children and youth. And that is a very important thing we see. See, this is very unprecedented times. Right. And we know we have never seen that. We are facing it for the first time, but it is called a global crisis and millions are affected worldwide and in Canada. But the problem with that one is that it has affected it definitely all the what you're mentioning, the travel ban and the isolations and everything. That has definitely has buffered the children against the acute illness, but that has put a lot of strain on families and children who are on the margins of the society. It is the reduction. All these measures have called reduction in school, after school services, basically programs. There are daycares which have been shut down and the numbers have been reduced. All the other services like speech, physical therapy, psychological, all the new programs have been decreased. This is very important because this school is not one room basically. This area, this classroom is the most important social neurodevelopmental area for the child basically. That's why physicians, a lot of mothers were asking me in August, shall we go to school or not? And I would say, look, we as pediatricians always promote go to school.
Good, yeah.
Because they are the very important developmental sort of a milestone which you need to achieve, and they will achieve and will mix up with other children and everything. But definitely we want the government to put on new sort of guidelines for isolating and staying in suburb and everything, but definitely there are. And these classrooms provide nutritious meal for children. It's especially true for children who are living, you've seen children, because I work in Toronto, I see the people who are living in the margins of the society, they are very vulnerable. These meal in the school is the most nutritious meal they will get in the day. They have the plate aggregation of tea they won't get at home. Home they are overcrowded. This is the school time, which is the respite time for them. Respite time for the families as well. Okay, and it's especially true for children who have more other complex medical issues like autism. And I know mothers who have come to me crying that they cannot handle. They cannot, because that 8 hours in school was giving them respite as a family. We are not getting that at the moment. And they are looking after the child 24 hours, that lost the job and everything, and putting a lot of strain in those families. Everybody has been affected financially and otherwise, but it is the children and the families who are the margins, who are in the poverty, like just above poverty or thing, they are being devastated by all the things. And the new immigrants, which have no social sort of setup basically around here basically. Single parents who are looking after the children, they have lost their jobs. Financial sector, yes, our government has done a lot for basically, in all honesty, basically giving them money and everything, but taking away all these support systems like in visits from the healthcare visitors, which see them and provide them with not only the meals but developmental support and everything, which is now lacking. Children in foster care are facing a lot of difficulties. And I said children, especially the children with autism, I go to Aeronauts Kids, I am there with their autism diagnostic program, and I see all the services have been cancelled. They're all virtual. And virtual services are, I know mothers who are crying that, look, we cannot do that virtual service because our child cannot stay still basically. And it has been devastating. There's one last thing I would say, that we have the solution to these things is important.
Yeah.
We have a solution which one of my very good friends and colleague has published an article as well, that look, we need to deem these services as essential services. We provide all the protective equipment to these home visitors, healthcare visitors, which you can pick up all the margins of society, at the margin of society, and we can help them.
Yeah.
Thank you very much.
So friends, this was Dr. Cheema, and I think the information, the way he has presented everything was something amazing. And I actually learned so much, and I'm pretty sure it will help you to understand about this COVID-19 a little bit better, and especially like the precautionary measures, especially when it comes to those little young kids who are in our families. And I think it becomes our duty as parents and as their guardians to ensure we protect them in this world-class pandemic, which is actually affecting all across the world. And I would personally like to thank Dr. Cheema for your valuable inputs, and it was such an amazing information. And thank you very much, Krish Hope Services, for putting this platform and bringing such an amazing personalities here to ensure that we provide the right information for those who need it. And so next week on Thursday, which is 22nd of October 2020, sharp at 7 p.m, we will be bringing another interesting topic, which is dementia during COVID-19, and the presenter will be Dr. Mini Joshipura. Don't forget to connect with us next Thursday, October 22nd, sharp at 7 p.m. And thank you very much for joining us today. Keep supporting us. Make sure that spread this message to as many people as you can, so that we can bring more awareness to the families and get rid of this COVID-19 as soon as we can. Have an amazing week ahead and stay connected. Thank you very much.